Welcome everyone to today's webinar, The Great Resignation and the Added Impact on Healthcare Revenue Cycle. I'm Kelly Gooch with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I am pleased to introduce our speaker, Amy Raymond, Head of Revenue Cycle Operations from ACASA. Amy Raymond is a revenue cycle leader with more than 20 years of experience in healthcare. As Head of Revenue Cycle Operations at ACASA, she leads a remote team of healthcare RCM experts located across the country. Amy was most recently a senior director leading the program management team in technology implementation at the advisory board, where she managed large-scale RCM implementations. She has overseen numerous revenue cycle teams for health systems large and small in different settings and specialties. With an interdisciplinary studies degree in health sciences from the University of Texas at Dallas, Amy's career is focused on leading RCM departments through process improvements and system implementations. Amy currently serves as the program's co-chair and webinar chair for the South Texas chapter of HFMA. Amy, the floor is yours.
Great. Thank you so much for that introduction. To start, in the course of my career, I have worked, let me get these slides right. I've worked in many different settings and levels of leadership in the revenue cycle. I've led remote teams, led centralized teams remotely, and led multi-site teams from a centralized location, pretty much any combination you can think of. And the one thing that remains constant is that staff engagement is paramount in achieving your goals, and it can be hard to achieve and maintain regardless of the environment or setting. But you have to have that staff to be able to achieve the engagement. I've seen it firsthand as a revenue cycle leader and then across countless health systems as a revenue cycle consultant, but we've always felt behind the curve when it comes to staffing. We're often placed in a reactive position to volumes, acquisitions, and other variables, excuse me, and this has never been more apparent than in the last couple of years as we've all adapted to life during a pandemic. Sending rev cycle departments home to work in a completely new environment than before with leaders who've never managed remote employees, laying off furloughing employees in response to drastically decreased volumes, and the need for more room in the budget, and frankly, people living through a pandemic and reprioritizing their goals and career expectations have all led to revenue cycle leads trying to figure out what they can do to both retain staff and hire to fill the void. Before jumping into our current topic, let's talk a little bit about the current healthcare landscape. This is probably all too familiar for most of you. In the upper left, you'll see the healthcare staff turnover rates have hovered in the 18 to 20% range for the last 4 or 5 years, at the same time that wages have steadily increased. This is important because every time we have a staff member leave, it costs us not only money, but productivity. As you see that, and you can see that play out on the bottom left, efforts to reduce cost to collect have largely plateaued. And while I suppose there may be some comfort and consistency here, I suspect it's a metric that still gets lots of scrutiny from your team. And given what you see in the upper right, it may not be sustainable for much longer. These are projected hospital volumes over the next 8 years compared to pre-COVID volumes. While inpatient procedures are expected to get back to circa 2019 volumes and remain relatively flat, outpatient volumes are expected to grow by nearly 15%, which means more work for your likely already overburdened staff. It's unsurprising then that automation in healthcare has been a rising trend. In fact, a survey we commissioned through HFMA, we found that 78% of providers anticipate automating some portion of the revenue cycle by year's end. All of these forces have converged, creating a sort of perfect storm, and are leaving us with really only 2 paths forward. Either continue adding staff or automating. As we just shared, the cost of hiring and turnover will likely make this first path unrealistic, which is probably why so many folks are already looking to automation. Today, we'll talk about both. If you're on this call, you likely already know this and are currently living it, but revenue cycle leaders today often feel that they're fighting an uphill battle. A higher rate of employees are resigning this year as compared to last. 18% of healthcare workers already left their jobs in the past year, and another 12% say they'll quit over the vaccine mandates. Questions like, are we sufficiently staffed? How can I reduce turnover? And what should I be doing to augment teams while faced with these staffing challenges remain top of mind for everyone. In addition to or contributing to the rate of turnover is the extreme stress being experienced by healthcare workers today. According to a poll by Mental Health America, 93% of healthcare workers report being stressed, 86% anxious, 77% frustrated, 76% exhausted and burned out, and 75% overwhelmed. With budget concerns around just making sure direct patient care positions are manned, revenue cycle is not always at the top of the stack when it comes to the budget, and oftentimes not viewed as essential as other areas. Revenue cycle departments are often one of the first groups hit with layoffs. For financial decision makers, it's easier to reduce labor in a non-patient care related area like the revenue cycle, of course, even though that department does play a direct role in the patient experience. Revenue cycle leaders have poor insight into productivity and actual time per task, making it hard to accurately and consistently predict necessary staffing levels. Because frankly, most EHR systems don't give accurate data around the time involved to actually execute the full task. Because of these staffing problems, it's difficult to find the time and resources required to train and upskill revenue cycle specialists. And then staff turn and the onslaught of COVID have both resulted in healthcare professionals working overtime and extra shifts. In speaking with numerous health systems, I've heard this time and time again, and see many health systems turning to automation. This quote from Bill Arneson at Moffitt reflects that. He said, anything that we can do to automate this work is a tremendous effort I can't read. Anything we can do to automate this work is worth a tremendous amount and is where we're trying to focus our efforts. Perhaps you're in a similar boat. We all know engaged employees are less likely to quit. This is especially true as wages in other industries rise and remote opportunities have become increasingly available in other operational and administrative type positions. The U.S. workforce polls show a 36% engagement rate, leaving over 60% of our staff disengaged at best or disgruntled and completely unhappy at worst. Engagement is key to retaining talent and avoiding the cost of replacing that talent. Acosta research shows that replacing revenue cycle specialists with 0 to 5 years experience costs over $2,000 and takes on average 84 days. These numbers are even more concerning when you look at revenue cycle staff with 10 plus years experience, with a cost of over $5,000 and an average of 207 days. That is 84 to 200 days of unworked accounts, less production, and current resources being spread thin to cover that gap. Not to mention the cost and productivity hit of training new hires once the position is filled. So what can we do to keep staff engaged? Let's look at these 4 tenets. First, empower your team to work at the top of their skill set. Automation takes a lot of the grunt work out of the picture. This gives your team the chance to work on areas they excel in and pursue challenges they're interested in. As a leader, facilitate this by leaning into their strengths. Oftentimes, someone is really good at a certain task, but they don't have the time to do it often. Once automation is in place, let that person do those things full time. For example, with claim status totally automated, newer team members can work on driving down denials, while those with more experience can work on appeals and so on. Train up on your weaknesses. Going back to realistic expectations, make it known to your team that they won't be as productive or quick at whatever new task they're handling. Reassure them that they'll get faster over time and monitor their performance to provide help whenever needed. And then lastly, share timelines for growth. Make sure your team is progressing in a timely manner. If certain people are lagging behind with learning new tasks, assist them. Give them the chance to shadow more experienced employees, provide additional training, and also let them in on the timeline for an overall training program for the team or any timeline for moves and changes across the team so that they can be kind of in the know and understand what's coming. A critical piece of keeping staff engaged is providing training. It's easy to overlook, especially when your resources are strained and your focus is on performance and ROI. But training not only plays a large role in performance, it also helps with engagement. Axonify discovered that 92% of employees experience a positive impact on engagement when they also said they received proper training. So let's talk about some recommendations to consider when structuring or updating your training program. First and foremost, training is not a one and done. Provide an ongoing training that prevents your team from falling behind and gives them the opportunities to expand on their abilities. Let them play a part in the training program. Give them a chance to submit topics they'd like training on to ensure you're checking all the right boxes. For For those of you who've been in kind of line level management roles, how many times have you corrected an error or provided coaching on an issue and heard, I wasn't trained on that immediately. And, I always used to have to explain to new hires that we literally cannot train on every single item or edge case in a new hire training program. But here's what you can do to support your teams and help them feel informed and able to execute appropriately on the accounts assigned to them. Make it a procedure to document those exceptional denials or use cases, and incorporate this into your training so every specialist can learn from firsthand experience of others. It may not be incorporated into the first few weeks of new hire training, but we'll talk in a little while about finding locations to put that type of documentation that's easily accessible. Better yet, have people who have experienced those cases report on them in a meeting or in one of the team check-ins and explain what they did to correct the issue or how they navigated the problem. This gives them a stretch opportunity as well. An in-depth training handbook is great for onboarding purposes, but consider implementing digital learnings as well. It's easier to update digital materials than print, and it's also possible to incorporate multiple types of media like videos and make the training itself more engaging. 2 in 3 employees prefer self-led training, which is easiest to accomplish using those digital methods. Use your digital training platform to deploy self-led courses that employees can take when convenient. You can also create bite-sized videos or digital trainings on topics that are easy to find and digest for team members looking for help or confirmation on what they think they know. And then once you've created the materials, you can redirect the staff back to that documentation to both reinforce autonomy and encourage their use of the provided resources. Build an internal wiki or other documentation method where general processes and exception cases are all stored. This could be in the form of documentation or videos, etc. This makes it easier for new hires to get up to speed, but also prevents institutional knowledge from walking out the door when someone leaves. And finally, celebrate learning and establish an environment that is supportive of training and education. Offer milestones when staff hit different levels, such as promotions, pay raises, or even just praise or smaller awards. We've covered a lot of tips for better retention through increasing the staff engagement, but let's now talk about recruiting and how your recruiting efforts can be expanded to support your needs. Now more than ever, we're seeing a need for flexibility and creativity when evaluating candidates and attracting the right people. As a result of COVID, quarantine, working from home, and just a greater overall sense of mortality, the current workforce has reevaluated their priorities. Their needs for an employer and what they are willing to accept have evolved. This means that in order to attract and retain talent, we have to evolve with them. First, competitive benefits are a must, but not just the traditional insurance coverage and 401k. What other benefits are you offering? With a focus on self-care and overall wellness, rightfully so, people are looking for a better work-life balance and ability to better care for themselves as well. Offer gym memberships, more generous or flexible PTO policies, subscriptions to wellness programs and meditation apps and things like that. Offer even paid certifications or industry-relevant memberships. Second, expand your reach. Do you allow remote work or even hybrid work for your staff? I know this is a big topic, but did your team work remotely during the earlier days of COVID? If so, are they still? Are they allowed to? Have you considered letting them to continue that? Why not? Allowing remote work does a multitude of things, but for one, it allows you to recruit more broadly and in new areas and demographics. It immediately opens your candidate pool to a world that you were not exposed to before. And related to that is get creative and hire from unique groups. I'm personally a military spouse and not only value but require a remote work environment. Otherwise, I would only stay with an employer for 2 to 3 years until we move to the next duty station. The military and veteran communities often have extensive skills, both proven in your industry and not directly in the industry, but applicable. I won't get too much on my soapbox here with all my stats, but military spouses are often more degreed than their civilian counterparts, hard workers, excited to have a remote job and build a career they can take with them while supporting their spouse and serving our country. Recruit also from undergrads and master's programs. Along the lines of the bachelor's and master's programs, don't just recruit from there, but create relationships with those nearby schools. And frankly, billing and coding schools certification schools go along with this as well. Create a pipeline for internships or fellowships. These often turn into full-time employment and give both you and the candidate an opportunity to determine that the job is a good fit for both. Rethink your priorities. Are you looking for direct experience only, or are you willing to bring someone on with applicable skills and teach them the fundamentals of revenue cycle? These employees often end up among your most loyal because you gave them a chance and you taught them and they've learned from you. Look for a passion and desire to learn. And lastly, consider the whole person, not just their resume or how they look in a video interview. Keep an open mind and look for those things that can make someone a contributor to your team. And last but not least, lead with values. People are prioritizing work with an important mission. We've heard this time and time again. Personally, I've interviewed countless people in the last few months, and the one thing that is said almost every single time is that they want to work somewhere with a mission. They want to be helping something, a process. They want to be fixing something that's broken. People want to feel connected and be part of a solution, part of a mission that helps, something greater than themselves. Show your candidates your mission, what you do, and how Revenue Cycle supports that mission. Discuss the value they're bringing in the day-to-day work they'll be doing and how it connects to the community. It may not be the most traditional approach or thought process, but this is one of the easier ones for me. I firmly believe that we're all doing hard and meaningful work in the revenue cycle. There's a tendency to write it off as, dealing with the money or collecting or doing the dirty work. But the fact of the matter is that the work we do in revenue cycle keeps the doors open for patients to receive care. It's what allows the health system to invest in equipment and staff. Challenging payers to pay the claims fully and in a timely manner is part of our job as a patient advocate. Challenging payers to pay the claims fully and in a timely manner reduces the burden for the patient, potentially reduces the negative impact to their financials, and even avoid medical bankruptcies. Better cost estimates and price transparency help the patient and their families prepare for financial impact, apply for assistance if necessary, and be more in charge of their care. The less stress from the patient throughout this entire process, the better the experience overall. Revenue cycle has a direct hand in that. In this section, we'll talk about deploying automation as a key strategy to mitigating retention and hiring issues. We've talked about the strategies around retaining staff, hiring new staff when necessary, but now let's talk about supporting your staff through the use of automation. Remember when I mentioned empowering your team to work at the top of their skill set as a key tenet for engagement? Automation can help you do just that. My future vision of revenue cycle would be one that has a small group of highly skilled revenue cycle analysts that can manage the big problems with high complexity using their experience and skill sets, with the smaller and more administrative tasks being handled by automation. The goal of automation is not to replace staff, it's to reduce operating costs so people can do what they love and health systems can allocate resources where they matter most. Think of automation as plugging in well-trained, because it's trained on your data, virtual FTEs or entire teams of FTEs. That said, not all automation is created equal. You have to select the right automation and automation partner. The best automation should streamline workflows and learn from exceptions, and the right automation partner should instill confidence in your team that those removed tasks are being done well. Look for true AI-based automation. I cannot tell you the number of times I've implemented automation into a workflow just to train staff members on working the new tool, the exception queue, a new login, a new process, a new application to navigate, new exceptions to work. That is so frustrating. Nearly 60% of healthcare organizations believe robotic process automation is a type of AI, but it's not. This is important to understand the difference because they work differently and they bring different values to the table for you. First off, RPA is fragile. It has a use and it has a good use in revenue cycle, but it's for more static, simple tasks, and it makes existing tasks quicker, or it can make existing tasks quicker. But it's costly, or it can be costly. Much of this comes from RPA requiring tweaks to overcome the exceptions, like new input forms or changed interfaces. As a matter of fact, Forrester, a couple of years ago, found that for every dollar spent on RPA, $3.41 are spent on consulting resources. That's a hidden cost that many people aren't expecting or ready for. AI automation should perform the work entirely, not only portions of a task, dropping the rest to exception queues to be worked by your team. True AI will automate logical, linear tasks and require no input from your team while also learning from exceptions. When looking at automation solutions, look for the one that requires little to no disruption to your team, and that is where you're going to find the biggest wins. The values of automation are obvious. Automation increases staff productivity by 8 to 14 times or even more. It's important to mention here again that while AI automating tasks can assist in reducing staff if that is your primary goal, it does not inherently do so. Humans can just only work so fast. And implementing automation allows you to work segments of your AR that you may not have been getting to anyway. I think as revenue cycle leaders, everyone struggles to ensure that they're touching every account, and usually that doesn't happen. Actually, I've never met one that feels like they're able to really work every single thing they need to work. Instead, they're forced to make prioritization decisions across types of denials, dollar thresholds, days to check for claim status, and they know they're not always able to get ahead of that game because they're having to prioritize it based on the staff that's available to do the work. Automation allows you to expand that capacity and do it all. Depending on your automation partner, you can also restructure your costs into a shared cost model. And then one of the most important areas is that you can harden your operations through resources that can perform continuously regardless of external variables. When you weave in automation, the technology essentially provides you with those virtual FTEs, and they can ramp up or down as needed without significant notice. Finally, doing all of this allows you to create a stellar patient financial experience. With an automation strategy that comprehensively addresses complex and repetitive processes, your revenue cycle staff can shift to those more complex tasks that we've talked about, but also to more strategic and meaningful patient-oriented tasks. Tackling the entire revenue cycle process from pre-auth to claims payment sounds amazing, but would obviously potentially be a daunting, long implementation process. We know that revenue cycle is prime with opportunity to automate strategic areas that cause your staff the most problems and result in the most denied claims. The answer here is automate what matters most to your organization. What I will say, though, is in my 20 years of leadership, consulting, project and program management in the revenue cycle, I've been asked many times what the top areas to target should be for any process improvement initiatives, consulting, automation, anything of the above. I'll explain this to you as we take a look at one of our multi-state customers with nearly $1 billion in net patient revenue and how they implemented the following areas. So first off, we know that denials are a top issue. But what is the root cause of most denials? Does automating working those denials solve your problem? No. Likely the top reasons are within registration and authorization related denials, eligibility, all of those eligible benefits, registration, authorization. Therefore, let's start up front. Focus on fixing the problem at its root by implementing technology that gets it right up front and avoids denials. Implement an eligibility tool that can take data straight from the card and input it for the eligibility response into the EHR, into any other tool that you're using. And use ML to then learn requirements and complete the function of prior authorization, one of the most time-consuming processes across the revenue cycle. The next bucket of issues is claim status. This function is a necessary evil to navigate through the world of payers, contracts, and timely filing requirements. Working follow-up and no-response claims quickly and efficiently allows your team to more appropriately focus their efforts on claims remediation. Excuse me. Claims remediation requiring higher skill levels and more quickly direct their focus to correcting payer information, resubmitting claims that are not on file, or providing necessary requested information to payers, and ultimately avoiding timely filing denials. We then come to denials, which hopefully are reduced based on some of the work being done on the front end, but they're still going to need to be worked. You want a technology that can understand denials by payer requirement and make determinations on next steps for the claim, whether that be a technical rebill, appeal, or write-off. Unified automation uses a unique method of observe, learn, and perform. Because it's AI-driven, multimodal data inputs are put into the algorithms that allow the machine not to just learn the workflows, but to learn each specific customer's workflows, outcomes, payer mixes, et cetera. So we started Acasa by observing existing workflows from a deployed proprietary software that captures data sets to provide a 360-degree view of our current workflow, of our customers' current workflows and processes. Our machine learning algorithms are then trained using that data and autonomously construct complex workflows that are impossible to script by hand. They also correct broken workflows and eliminate unnecessary work. And then lastly, the system starts automating tasks and performing. It operates in the same billing system as your staff, And if complexities arise, such as changes to payer protocols, the system immediately flags our revenue cycle operations team, who triage the problem and resolve it in real time while our system is learning the process. This is the key to unified automation. Your RCM operations continue uninterrupted. Continuous learning is built in, and it provides peace of mind. Perhaps the most important element of automation solution is human judgment. This may seem counterintuitive by definition because automating work means technology is performing the task rather than a person. However, solutions designed with only the most commonly occurring tasks or scenarios in mind consistently fail to meet expectations because of the highly dynamic nature of healthcare in general and of revenue cycle operations in particular. To date, the technologies used in revenue cycle operations have augmented staff or automated simple, discrete portions of a task, but most solutions fail to automate the entire task. Even robust bolt-on solutions still end up requiring humans to verify accuracy and work exceptions. There are two fundamental reasons solutions have fallen short. They've been developed with a lack of subject matter expertise in revenue cycle operations, and the solutions lack the capability of navigating the constantly evolving variables involved in revenue cycle. Experience and expertise in rev cycle practices are essential. Every health system serves a unique community and handles a unique set of payers. Rev cycle practices developed at one hospital rarely translate entirely to another hospital, even within the same system. Generic automation solutions developed for other industries may be able to handle some simple and static tasks within the revenue cycle, but typically fall short of automating full functions. Understanding the nuances of how requirements vary by payer and the unique terminology and shorthand for documentation used at a particular provider usually takes years for people to learn. The good news is that machine learning and AI-based solutions are emerging that have the capability to learn these subtleties and learn them far more quickly. Historical records can be used to train algorithms on the nuances unique to each hospital and learn the requirements of the specific payer set that may also be unique to a particular hospital. While machine learning tools offer the promise of automating far more, they can only do so if they're developed by individuals with deep subject matter expertise in the revenue cycle. This graph is actually depicting the volume of production the machine learning agent had with the customer that I mentioned before, month over month starting in August 2019. You'll see that as the machine gets exposed to more data, the confidence levels increase so that it can take on more edge cases, more payers, etc. You'll also notice this happened pretty rapidly. Of course, there's a dip in April, May, and June of 2020 due to the decrease in the system's overall volumes because of COVID. But our percentage of tasks completed continue to increase, providing that continuity the system much needed as they were sending people to work from home and losing their own productivity in that shift. As we've said before, even before COVID, rev cycle leaders struggled with forecasting changes in volume, acquisition, and other variables that would impact volume. In a much bigger way than ever now, leveraging automation is critical in order to quickly scale up or down as the conditions demand. There's really no effective way to do this otherwise. We can't immediately hire and onboard staff. We can't rapidly turn to a third-party agency and get their team up and running immediately. But when automation is in place, it can adapt immediately to volume and productivity needs and fill those gaps for you. So obviously process improvements can be found and implemented without implementing automation. It's important to constantly be reviewing current processes, seeing how the teams are working, and understanding if improvements can be made. I'm going to talk about process improvements that can be made outside of implementing automation, as well as once you are using automation. So first off, when you have any sort of automation in place, train your staff to work with the automation. One of the biggest frustrations with any new technology with line-level staff is that they can feel out of the loop, or they miss the kind of what's in it for me, and just feel like they have more work to do, or that they have a lack of trust of the work that's being done and whether it's going to be done as well as they did it. And really, you know, a lot of times their opinion is that they're going to have to pick up the pieces anyway, so they may as well keep an eye on things because they're not sure how this is really going to work. When you implement effective holistic automation, it should be thought of as a revenue cycle partner. Train your teams to work in collaboration with the automation and treat it like a new team member. Furthermore, inform them of the implementation process and how it's going to benefit them, the timeline for the implementation, and all of these great things that we've just talked about that you're going to do with that implementation, like training them and teaching them new things and and things like that that allow them to be part of the process, understand the mission of the implementation and where they fit in. And then once you have the automation doing some of the more rote or monotonous tasks, there may be a concern about what to have your team do. They certainly have that concern, but you've already addressed it. We talked earlier about moving them to more challenging tasks, which allows them to work at the top of their skill set, which is fantastic. However, how do you make sure they're ready for that? Some things to consider here are setting up a kind of one-on-one mentoring program for rev cycle specialists, where less experienced team members have opportunity to work with more experienced team members. This could be in the form of shadowing them while they're doing more complex work, a little more formalized kind of one-on-one training from the mentor on new tasks or more complex tasks that the more junior person doesn't know about yet or know how to navigate, or even just setting up regular time for kind of Q&A, where they know they have that time set with someone who knows what they know and can help them guide them through the process. Continue to grow your more experienced group by working with them to host lunch and learns or other training sessions that staff can attend. And I'm not necessarily talking about those already in some sort of leadership in your team. This could be line level staff that just excel in a certain area or do really well, or you consider you're expert in certain things. It may be a little more work intensive for your leadership in the beginning as they coach and guide the team members to get it up and running, but it really serves you well in the long run as you begin to build a more sustainable model and promote growth from within your teams. Sponsor memberships for your teams. This was also mentioned as a possible benefit to attract candidates, but for your existing staff, it can be used to allow team members to further their growth through certification classes and just in general the content available to help them with those memberships. And definitely not least of the tactics as far as efficacy goes, but it can be more costly. But if you just don't have the staff or talent within your team to really sit down and complete full process evaluation, a consulting engagement may be the way to go. You can engage with a consulting firm to both, look at your processes and create improvements, but also just to create a full-scale training program and help execute on that with your team. So next we talk about engaging your team during and after the implementation. Some people may feel that they're not needed if you're putting automation in place and it's going to work what they're doing. And the fact of the matter is it might be working the actual task someone is working today, but you have a plan for what that person's going to do instead. So your team needs to be engaged in that plan. First off, they need to understand, I think we all know the workload in healthcare is growing, not retracting. So we still need people. And kind of to that point earlier that I was mentioning that, we all have to make decisions and prioritize, and this allows us to work more of what's out there on our AR than we were before. Second, you need your team. Automation is growing in leaps and bounds, but a human element is still a must in healthcare. Not only are there tasks that only your team is capable of doing, but patients and practitioners alike feel very strongly that it's important that the human element continue, especially in remote settings. And then keeping your team after you implement automation allows your organization to achieve exponential benefits. You're not replacing that work, you're adding to it. The automation handles some work while your team gets to do even more impactful, meaningful, high-quality work. And it just widens the net of the work you're able to accomplish now together. No amount of automation will replace the importance and role of your revenue cycle team. As you automate more and more tasks, you're faced with an incredible opportunity to turn your revenue cycle specialists into patient advocates and deliver the experience that wasn't really possible pre-implementation or pre-automation. And then improve your processes even when they work. Put QA and audit processes in place to do periodic reviews and just make sure that things aren't being missed. This both helps with compliance to process because you might find that people are kind of slipping and just not kind of following the intended process. It also might help with identifying better ways to do it. So be open and willing to updating and iterating on that. And really considering where you can have further improvements. Sometimes when you implement process improvements, you already know you're kind of implementing it by phase and you're doing, one piece before you get to the next piece. And so really having the discipline to keep going through those phases is critical. Automate everything you can and focus humans and process improvement on the rest. Foster an environment that celebrates those that bring forward ideas for improvement. This empowers your team to help you with process improvement. It's not just on a select group of leaders. Make process improvement a team sport. Reward process improvement through that celebration or even more to help inspire others to do their best and drive staff engagement. And then key takeaways to stay ahead of the curve. The revenue cycle has just been stuck in a bit of a state of stagnation driven by old technology, ever-increasing quantities of data to manage, not to mention constantly changing payer environments that we're responding to. We know that staffing challenges are not going away. We had them pre-COVID, we're definitely seeing them throughout COVID, and we have no reason to believe that the problem is solved automatically post-COVID. As an industry, we've spent years and years testing changes in various areas and hoping to impact change, improve cost to collect, decrease time to payment, make things more efficient, and we've just fallen short time and time again. We've never quite hit the mark. I think it really proves that it takes a holistic look at staffing, recruiting, training, processes, and automation in order to plan for the future. The good news is that increases in automation and AI adoption are paving the way for very exciting developments. This, coupled with the rapidly shifting workplace and looming post-COVID world, will drive change for the revenue cycle. And then lastly, automation is here to stay. I think we 80% agree with that, if not more. It will play a pivotal role in the evolution and success of revenue cycle departments. All right, thank you. Kelly, I think you have some Q&A to start with. Are you there, Kelly? Okay, let me look through a couple of the questions. See if I can find them. Sorry about this, guys. Okay, I don't see a ton. I have one question I'll answer, but in the meantime,
yes,
feel
Amy,
free.
I am here, and thank you so much for that fantastic presentation. We can go ahead and begin that question and answer session. So please submit any questions you have by typing them into the Q&A box you see on the dashboard, and we'll try to get through as many questions as we have time for. And I'm seeing one listener who would like to know and ask the question, in an ideal state, is the automation autonomous, or do my team members need to engage and manage the automation?
Yeah, I think depending on the automation you implement, the unified automation at ACASA, the team does not need to babysit and manage. That's actually a function that is done internally with ACASA through the revenue cycle operations team. We also provide dashboard type reporting so that you can kind of see volumes and understand what's going on. So it's not a black box, but there is no exception queue. There is no kind of tool that your team works. We plug in like another analyst or 20, 25 analysts and do that work alongside your team in your existing system. In contrast, there's plenty of automation out there that can help further kind of your work in the process, but it doesn't really automate the full workflow and take that off of your team's plate. That can be valuable too. Those do generally need to be kind of managed or worked from an exception basis, but that is not how our automation works. And then I saw another question asking about, with my staff being remote, how can I ensure or measure how productivity is being impacted? And I think it's an important question, especially as you're considering a more flexible work environment for your team. Just putting people remote might feel like an engagement boost, but if they don't feel well supported and they're not being managed well and you aren't able to manage outcomes and expectations, then it's not a win-win for everyone. So I'd say that it is really critical when considering remote employees or remote teams or whatever combination of that. It's critical to have the reporting in place from a productivity and a quality perspective. Generally in the office, when everyone's sitting with you, you're still hopefully running some productivity reports and understanding kind of the numbers of what people are working and making sure that they're hitting the mark, as well as doing some quality review. I would say that all continues in a remote environment, but your ability to access that reporting in a more automated way is really important to be able to support you as a manager or a leader of remote teams.
Yes, I also see a question here as well. Previously, when you have deployed new technology, it's taken months to activate and actually start to see results. So can maybe talk a little bit about being ready for the next big crisis and how automation can really help with that.
Yeah, so, I think if I understood the question correctly, like if you engaged any automation vendor today, you're not going to have automation up and running at 100% next month, right? There is a process. It's shorter with more unified automation using AI, where it can be shorter than the time that it takes to sit down and write, hundreds of thousands of scripts for kind of a RPA type solution. But what I would say is that implementing automation now is critical, whether it gives you that support you need tomorrow or whether it gives it to you over the coming months. And I think we all learned just kind of being back on our heels a little bit when COVID started. Many people at that point were like, okay, what do I need to do to fix this? And we felt like we were behind the 8 ball and trying to solve the problem. And so I think the takeaway here is that now's the time to do it because we don't know what's coming. And it is finally a solution that allows us to be a little more ahead of the curve when it comes to being prepared for volume and staffing fluctuations. There's a lot of variables that could impact the need for staff in the revenue cycle. And I won't say they become moot, but it's definitely, provides a more consistent and hardened operation for you when you have automation already implemented and in place.
That's a great point. And we have another question here, and this person is wondering, do you offer a demo?
Yes, of course. We'll have our contact information at the end of this in the materials that are handed out, and so I'm happy to discuss further with anyone who's interested.
Great. And we also we have a question here that really addresses what you were talking about supporting education as a way to keep staff engaged. And would you mind expanding on what programs that you should be looking at?
Sure.
Specifically?
Yeah, a lot of employers offer some sort of tuition reimbursement, and that can be used for various colleges that offer certification programs for billing and coding and collections and those things. So that's one area. Another would be, or something to consider, as well as more traditional degree-based education. But also professional organizations like HFMA, MGMA, HIMSS. There's numerous organizations that you can be a member of and benefit as a member from free certification tests, classes and tests. And many of the local organizations also offer like cohort study sessions and things like that where, it's a great networking opportunity, but it's also, just the content that's available and the learning that your employees are able to have really benefits you as their, employer as well as them in their career path. And that's the kind of win-win that a lot of candidates are looking for when it comes to what employers are willing to invest in them.
Great. And we had another question come in here of wanting to know how can they learn more about today's topic and solving staffing challenges?
Oh, yeah. I think similar to the question about if we do demos, we'll have our contact information. Obviously, my email's right here, but we'll also share our contact information, I believe, as part of the takeaway materials from this session. So that will be information accessible, and you are welcome to reach out to us. You can also find us at our website at acasa.com and fill out a contact request there.
Great. And it looks like maybe we can fit this other question here as well. But is there anything you want to expand on, Amy? One reader wants to know about what ACASA actually does as far as management and consultancy and what you bring to the table in that realm during implementation.
Yeah, specifically with ACASA, I think our customer success department does an amazing job of guiding our customers through the implementation process. We don't offer formalized kind of sit-down full consulting engagement, but we have I mean, the depth of revenue cycle experience on our implementation teams is amazing. And so we do offer that expertise and many, many years and many employees of experience through automation implementations as well as deepen revenue cycles. So we're bringing that experience to the table built into the processes that we're implementing. And we will help guide our customers through not just the implementation, but how to think about things, going forward, similar to some of the things that we talked about. So those are part of the regular conversations we have. As far as a formal structure that we put in place, maybe at the organization or the customer organization, we don't do that. But we're very supportive to the project team with our customers to make sure that, they're learning our best practices that we've learned across the board and through our years of experience as well.
Great. It looks like that is about all the time we have for today. And I want to thank you, Amy, for your excellent presentation, ACASA for sponsoring today's webinar. And I hope everyone enjoys the rest of their day. And we look forward to having you join us for future webinars.
Great. Thank you, guys.